Hello everyone, welcome back to my channel. In this video, we are going to discuss about the classification of hypertensive retinopathy. So basically, what is hypertensive retinopathy? It is a condition that occurs due to the long-standing high blood pressure, that is a hypertension, which affects the blood vessels in the retina, that is a light-sensitive layer at the back of the eye. Now, the classification of hypertensive retinopathy is typically based on the severity and the characteristic features observed during an eye examination. Now, the Katz-Wagner-Barker classification is commonly used for this purpose, and it categorizes the hypertensive retinopathy into the 4 different grades. So, the first one is the mild retinopathy, the grade 1. So, in this, what happens is that there are mild narrowing of the retinal arteries, that is known as arteriolar narrowing, and increased light reflex, and this is due to the arteriolar wall thickening. The arteries may also show the mild tortuosity, that is the twisting and the curving, and mild focal constriction. Now we have the grade 2, and that is the moderate retinopathy. So this stage involves more narrowing, more severe narrowing of the retinal arteries, and increased arteriolar reflex, wall reflex, and more pronounced arteriolar tortuosity. And additionally, there may be the AV crossing changes, that is arteriovenous crossing changes, such as the focal arteriolar narrowing at the crossing points, and the AV nicking, that is compression of the veins by the arteries that have been thickened. Now we have the grade 3, and this is basically the severe retinopathy. Now the grade 3 hypertensive retinopathy is categorized by even more severe arteriolar narrowing, extensive AV crossing changes including the AV nicking, focal arteriolar narrowing, and retinal hemorrhages. These are basically the small bleeding spots in the retina, and these hemorrhages can be the blot hemorrhages or the flame-shaped hemorrhages. And then you can also see the exudates, and these exudates are cotton wool exudates, or you can say that these are the yellowish deposits that may be seen in the retina. Now let's discuss about the 4th grade. Now in the grade 4, this is known as malignant retinopathy, and this is the most severe and advanced stage of the hypertensive retinopathy. Now the grade 4 features include all the changes that are seen in the grade 3, along with the presence of the optic disc swelling, that is known as a papilledema. Now the papilledema is basically caused by increased pressure in the optic nerve due to the severe elevated blood pressure. The optic disc may appear swollen and may show the hemorrhages or exudates. So now this is important to note that the hypertensive retinopathy classification is just one aspect of assessing the impact of high blood pressure on the eyes. The overall evaluation of the patient with the hypertensive retinopathy includes considering the stage of retinopathy, blood pressure levels, presence of the other eye conditions, and any systemic complications of hypertension. Alright guys, so that was all about the stages of the hypertensive retinopathy. I hope you enjoyed this video. Thanks for watching.